Good afternoon, everyone. My name is Penny McBride, and I'm the chair of the Board of Trustees for Hill Country Memorial and also the president of the Chamber of Commerce here in Fredericksburg. But my role today is that of moderator for this webinar, and it's an exclusive opportunity for you to learn more about Hill Country Memorial's initial and ongoing response to the COVID-19 pandemic. This has been a challenging time for everyone. It's impacted each of our lives. But at the core of this, it's a global and historic public health threat. And as your board chair and as a lifelong resident of Gillespie County, I'm profoundly grateful to our entire healthcare community and to the whole team at Hill Country Memorial for providing a quick and competent response and for their maintaining readiness and flexibility as the situation unfolds. I'll begin today by introducing our expert panelists, and I'm going to ask them a few questions just to set the stage. But we're also really anxious to hear from each of you, and I encourage you to ask any questions that you may have. To do so, you can look at the bottom of your screen. You'll notice a chat function there. Just type in your questions and I'll be on the lookout. I'll pose those questions to our panelists and we will get to as many as time allows. So again, thanks for making time to be here today, but let's meet the people who are our subject matter experts. Today, I'm joined by 4 panelists. We're delighted to have Dr. James Parton, who serves as the Hill Country Memorial's Chief Medical Officer. We're also joined by Dr. Claudia Frias, and she is the Medical Director of the Wound Clinic and the Hospitalist for Sound Physicians. Also, we have Jane Pope, the hospital's Chief Executive Officer, and Amanda Stevens, the hospital's Chief Strategy Officer. So thanks to each one of you today for making time to share this information with all of us. And I think maybe the best place to start would be Dr. Parton. Dr. Parton, I've been on lots of calls with you the past few months tracking this pandemic and how it's unfolded in Gillespie and surrounding counties. Maybe you could start us off by just giving us some numbers or some current context of what the infection rate is here and just getting us all on level set with that information.
So currently, officially, Penny, we have 35 active cases in Gillespie County. We have had, unfortunately, 6 deaths, and thank goodness that has been a stable number for at least a couple of weeks. We have 2 that are hospitalized in the COVID unit, and it leaves us with 2 ICU staff beds available for other admissions and 12 beds total for other admissions unrelated to COVID. I have a little bit of concern, and Jane has not heard this number because I calculated it last night after I talked with her last, is that, we were 16% positivity rate in our testing. And I keep saying our testing, I probably should clarify that we also include the Cornerstone Clinic's testing because they are doing a PCR rapid test in their office, and their numbers are including it in our numbers. So we're at 16% about 3 weeks ago. We progressively dropped down to just around 5% and stayed there for a good while. We jumped up day before yesterday to around 7.7%. And last night, I'm concerned about my calculations, has that now at 12%. And so we've seen a kind of a bump, and I don't know yet what the reasoning for that is. We've had a couple of public events, the horse races, and obviously people coming from our community, but we've got coming up holiday weekend with Labor Day, we've got school opening up, and so I think we've got to watch that number very, very carefully.
Absolutely.
Thank you for giving us that information, and we've also been watching the surrounding counties because we know that Hill Country Memorial serves those as well. So I think that's a good place for us to start. In talking about Hill Country Memorial's response, Dr. Parton, if you think back to February when the news of this first started coming to us, we first started hearing about COVID-19, what notable observations have you made regarding preparedness and prevention?
I think the hospital got extremely proactive very early on, and we actually built up a unit that included ICU and a number of beds in South Wing to be a potential COVID unit. Even brought in portable air scrubbers to make the normal rooms on 2 South into negative pressure rooms for isolation. Then had a good bit of education programs for our staff regarding COVID, regarding PPE, how to don and doff, and then how to protect themselves, protect the patients. What I didn't see early on, though, was a good bit of local preparedness for this virus as far as protection. We had a significant delay in getting people to consider social distancing and wearing masks. We had a delayed order to get a mandatory mask order. We had a number of things that I think let us increase our numbers that we could have actually prevented. I think we're fortunate in our community that we did react a little later on, and our numbers have kept under control compared to some of the other communities. Just go to look at Clark County. Clark County's numbers are significantly higher than ours. And so I think we did the things in the hospital as best we could. We started monitoring temperatures, questioning people, limiting visitation, limiting the number of members that come to our cafeteria. So we did a number of things inside the hospital that helped us, but like I said, outside the hospital, I'm a little concerned we're a little bit late in getting that stuff done.
Thank you very much. Dr. Frias, as a hospitalist who serves as a liaison for patients and their admitting provider, how have your conversations changed since March when COVID-19 first came into our communities? And how are they now?
I think that my conversations haven't changed much. I mean, we're still trying to get the patients to comply, wear their mask, and help us out with control. However, in a very positive turn of events, we have been since February able to acquire treatments for the patients that we didn't have before. We have right now plasma, convalescent plasma. We have remdesivir, which is the antiviral therapy. And we also have the assistance of the intensivist access physicians, which have, I mean, changed really the way that we can treat patients and the patients that we can keep in our community. So I think that the message to the primary care providers is we're doing our best to take care of the patients. Continue to do what you're doing. I mean, our community of primary care physicians in this town is just amazing. So I think that overall, our message is continue to take care of your patients, continue to send out the message of prevention, and we're here for you, and we can continue to take care of the patients as best we can with really the best of the best. This is what it's been doing in the biggest centers. I have contacts in the Northeast, I have contacts in San Antonio, and we are really have everything that we need to take care of these patients. If the patients need a higher level of care, then we have the help from the critical care physicians to be able to understand that that moment is here, and at that moment we'll arrange for the patients to go to a different facility.
Thank you, and I appreciate your comments around that it's a whole continuum of care, right? That those primary physicians are likely where some of those cases are first going to present, and I think that speaks to the partnership and the teamwork that we have community-wide. So I really appreciate you making that point. Jane, I think I'm going to bounce to you next. HCM team members have made a lasting impact on our communities. We are known for delivering, remarkable care. How have your conversations going around that, and what was the initial response that your team has had, and what key learnings have you uncovered in that process?
Yes, thank you, Penny. I would love to talk about the team and their response. And I want to talk first about the three panelists and their roles. And so I will start with Dr. Parton. You introduced Dr. Parton as the Chief Medical Officer, and then when Dr. Parton started to speak, he talked about the community response. And so really, because we have such strong physicians at Hill Country Memorial, including Dr. Frias, who I'm going to talk about being on the front line, we were able to repurpose some of Dr. Parton's work to that community outreach. And I think that has been pivotal in our success. And I'm going to talk about that community outreach in a few moments. Jim, I couldn't have done that and had Jim repurposed outside of the organization if I didn't have such strong medical leadership inside. And when I think about Dr. Frias, and I literally see her like running down the hall with her mask on and running into the emergency room to assess patients there. And then when I'm upstairs, I see her upstairs and she is just covered in COVID. And what she's doing is she is treating patients in real time. And you heard Dr. Frias talk about mining best practices. We went to a hospitalist group called Sound Physicians, and she's accessing her friends, her colleagues through sound in real time to make this the best place to serve for our team because they could be safe and that they could deliver that care with high quality. And so Dr. Frias's strength and her leadership enabled Dr. Parton to focus outside. And then one of the other key success factors we've had is we've had lots of learning through COVID. And one learning, I've had much learning, and one learning that I've had is about communication and ensuring that the team has real-time information. And Amanda has been critical to that success for us internally, and I know she will talk about it externally as well. When I think about our team, I think about mining that best practice clinically, mining that best practice from Texas Hospital Association, and some of the initial things that we did and continue to do make me proud. And what I want the community to know is that this organization treated COVID and will continue to treat COVID, but didn't forget about a strategy that has us focused so that we can ensure that we can look after our communities for generations to come. So I could go on and on. I will pause and move to another panelist.
Thanks, Jane. Amanda, that leaves you on deck. I have a question for you as well. And you and your team have a strong pulse on the community, obviously. And I've seen many acts of support demonstrated on social media, in our paper. It's been everywhere. Can you share the impact that the community has had on HCM?
Absolutely. Thanks for that question, Penny. The impact has been so incredible. It's really hard to quantify, but I'll tell you, coming into the office each day, we've been here and seeing ribbons tied on trees and airplanes flying overhead in a show of support, painted rocks that children have left at the entrance to the hospital, signs that have been hung in honor. And, you know, very early on, the Fredericksburg High School Billies basketball team made recordings of videos and cards that they sent in support of the HCM team. This has been really hard work that our team's been doing, and a lot of things that's been unknown, and we've been sort of building it as we go. But to have that community support, knowing that our community's behind us, they're here for us, they care for us, and they're finding ways to do little things that may seem little to them, but for the team, it's been really incredible and really impactful. It's just kind of buoyed us up and given us the encouragement to continue on. And from a financial perspective, we early on launched a Greatest Need campaign to the Hill Country community and asked them to come alongside of us so that we could be here to support not just people who are coming with COVID, but for moms having babies and emergency care in the ER, and for our home care and our hospice teams. And our community came together with a tremendous amount of support financially. Gave over $500,000 to our HCM team. And those gifts came from donors in the community, from physicians, from our own team members, from our leadership team, back to support Hill Country Memorial and the team here so that we could have the infrastructure, we could have our team solidly in place to make sure that whatever COVID brought, we were here and we were ready.
Well, that is exciting, and I'm not surprised by that because our community has such passion around healthcare and great providers. But I guess just intervening a bit myself, I think the best way we could support you guys in moving on too is to keep wearing that mask, keep practicing safe behaviors, right? So
Yes.
Yes, please.
Well, with that in mind, maybe that's maybe a good question is like we've heard so much about COVID-19, but we know that flu season, just regular seasonal flu season's right around the corner. So I think a lot of us are concerned about what is the response when you lay those two situations atop one another. What is the response and what's the best way that we can be mindful around that?
I could start that discussion. First of all, get vaccinated. And also I must let people know that people my age, anyone who's 65 and older should not have just a regular flu vaccine. They need a high dose flu vaccine, which is 4 times the level of antigen in the vaccine than normal vaccine, because our immune systems may be a little bit weaker. Number 2, I think that all the things we're doing for COVID-19, social distancing, wearing masks, washing hands, is also exactly the same thing you do to help prevent the spread of the influenza virus. And so I think we need to continue on what we're doing for the COVID-19. And we have discussed this in some of the STRAT meetings, which is South Texas Regional Advisory Committee of our Region 8 on our roll call on Mondays and Fridays, that the season in the Southern Hemisphere, which are right now at their peak, has been a significant lower level of influenza than they've had in the past. And so what they're doing for COVID-19 is helping reduce the spread of the influenza in their peak season in the Southern Hemisphere. So I think we'll continue to do what we're doing. We'll see hopefully a less level of influenza. And I must tell you, we discussed also in the STRAC meeting that when we started with the basic surge of COVID-19, we started from a ground zero. I mean, the hospitals had no COVID-19 patients in the hospital, so they could handle that surge. Right now in the metropolitan area in San Antonio, there are 600 COVID-19 patients that are hospitalized. And so we start out with that 600 being our base. We add another wave of COVID-19 plus influenza admissions, and it potentially could overwhelm the system pretty quickly. So we need to be continued very diligent, and like I said, all the things we've talked about: mask, washing hands, social distancing, stay home when you're sick, don't be the people that you know are sick, and hopefully keep this under control.
Yeah.
Dr. Frias,
I
did you
think,
want to add?
yeah, I think that whenever I get in contact with any patient, even when they're non-COVID, I try to kind of send them with a message: be mindful of your symptoms, vaccinate yourself, protect yourself, but also protect others. Because we have a greater responsibility with our elderly population and with our youth also. Just be mindful, be aware, and vaccinate yourself. There's a lot of misinformation and questions, and I'm always happy to answer questions. I mean, even when I'm in the wound care clinic, ask your doctor, ask your nurse, ask someone that can give you information, so that way you can get the right information to make smart choices, like getting vaccinated for the flu early, and get your elderly vaccinated, get your children vaccinated. Even more so with the school opening, we're gonna have a little bit of a challenge, as we do every year with infection control with the kids. I am worried about the fragility of our system, as everybody is. I mean, we are a small hospital. The big hospitals have the same challenge. There's a frail health system, and it's just the nature of it. So if you overwhelm us, we're not gonna be able to take care of anything, really. So it's in the community's hand to allow us to do what's best.
Well, that is so well said, and I appreciate the passion that you bring to that discussion. And I think I'm struck by the fact that we're asking people to do some pretty minor things, right? A few years ago when I got my flu shot, I was sitting there and I kept looking at the lady, and I finally said, "I'm kind of in a hurry. Will you give me the shot?" And she said, "I already did about a minute and a half ago. I was wondering when you were going to get up and go." And so that just shows what a non-event, getting this was. It was so fast and totally pain-free. I didn't even notice that she had pricked me. So I appreciate your comments around that. So Jane, I guess I'm going to bounce one back to you. Certainly as chamber president, I have seen the very harsh financial impacts that COVID-19 has had community-wide. And I know from my service on the board that Hill Country Memorial has been as impacted as harshly as any business sector could possibly be. Can you share with us what steps have been made to ensure our financial sustainability?
Sure. So we took advantage of any of the loans that were available to us. And so we are not in a crisis situation from cash flow. We certainly have those loans. Some of those loans will have to be paid back. So for example, we took a loan for our Medicare, Medicaid patients. And it looks like likely in October, we'll start paying that back. We thought it was smart to take that loan, put it in some interest bearing, low interest bearing, so because it has to be available. And so that we had some cash flow. In addition, we took some tax exemptions that we had that opportunity. We also, as an organization, had access to funds through the CARES Act. And so we have accessed those funds, and those funds will not be paid back. We have reports to do, and we're doing lots of reports to prove that that funding is something that we have earned. In addition to, Amanda already talked about those philanthropic dollars, which are so critical to the success of Hill Country Memorial. And so all of those have been important. And at the same time, we have had to look at our operations inside. It would be, when you asked me the very first question, Penny, about our team and what has our team done, I can go through clinically many of the things that Dr. Frias and Dr. Parton talked about learning to don and doff and learning new procedures. That's in the hospital. And I think when we think about Hill Country Memorial, we think about the hospital. But that's in the hospital, that's at hospice, that's at home health. That's in the medical group, learning to do virtual appointments. And it's in the wellness center. That's a part of Hill Country Memorial, and the wellness center, learning new procedures. And so all of those groups did things so that we could sustain care. At the same time, we had to look at our operation and say, we have less patients coming in. And so we don't want to furlough anyone, and we didn't, but we flexed. So flex to volume, and we didn't flex to COVID level. We flexed to our normal low volume levels, and we were able to flex to that higher level because of the investments that we had through the loan and through some of that CARES Act and through the community. We couldn't have done that without the community. And I look at all of those organizations who had to furlough all of that staff. I just couldn't do it. And so the community were partners with us with that. We continue to mind our finances. We continue to watch our productivity, and volume hasn't come back to the same extent it was. Some has, but people aren't seeking care in the same ways that they used to. And I think the four of us could spend a lot of time talking about televisits and the importance of having access to those going in the future. So long way to say we've accessed funds, we're in a good position, but we have to be mindful of our position.
So maybe it's a quick follow-up to that, Jane, as well. There's been so much in the headlines about the Paycheck Protection Program. Did the hospital qualify for those funds?
We have too many employees to qualify for that. We have 600 and some plus employees. We are working with the Texas Organization of Rural and Community Hospitals. If there was ever another program, they know the number of employees we have, and we would try to be working together to ensure that we would have access to those funds if such anything was to happen in the future. Thank you.
I have a few more questions, but I wanted just to remind everyone too, if there's something that you're considering or you want to ask that hasn't been covered, feel free just again to hover down on the screen. That'll bring up the menu bar at the bottom. Right in the center is that chat function. You just click there, type in your question, and I'll be able to see it and then pose it to our panelists just as a quick reminder. So also for my role in chamber, I know that every business has had to change the way it does business. And of course, the hospital probably has had to make more significant change than virtually any hospital, or I mean, any kind of business. So can any of you tell me what has changed with HCM's operations, its policies? What modifications have you had to make?
Well, Why don't you start, why don't you start, Dr.
Well, I was just going to mention that we know we've had to be very careful how we've done diagnostic tests for patients that have a potential for COVID-19. We've done radiology procedures in the parking lot. We have to have drawn blood and assess patients in their car. And I know the doctor's offices, the primary care doctor's offices have done the same. They go outside and assess patients that have potential COVID symptoms without bringing them into their office. And so we've got to be very careful what comes into our facility and what we can do outside of the facility that protects everyone inside the facility we have done.
I think that one of the things on my inpatient end has been, we have limited the visitors, which was a big change for us. I mean, having the family members there was helpful, was encouraging to the patients because they had, you know, an advocate for them there. That has been a big change, and we have been using technology to try to close that gap. It's never gonna be the same as having your loved one in the room, but we held important discussions with patients, even end-of-life discussions with the help of iPads. We have been able to get some of the nursing staff to call back family at a certain time of the day to keep that communication going. And the other thing that I think has changed a lot now in the outpatient setting in wound care, we used to work together with home care. We used to work together with hospice. Now we're relying on each other. I cannot do my work without them. And they rely on me to be able to work with the technology, with the units, they trying to show me the wound. And I'm like, too much light, to move to the right, move to the left. And their willingness to do it and to have that partnership has been sort of amazing. So I think that we have changed, and it was challenging. And I think we're at the point right now that we're still excusing the lack of visitors, but also letting them know we're really doing everything we can to be mindful of also the mental and emotional health of our patients.
Well, Dr. Freese, I've heard that saying about trying to build the aircraft while it's in being flown. I think that's been your experience the past couple of months for sure. Jane or Amanda, do you also have some comment around this?
One of the things that we have as a priority is that our team is cross-trained to different areas of the entire organization. And we actually had one of the ways we execute our strategy is through a strategic breakthrough initiative, a 90-day team. And we happened to have our ER director leading that team just as COVID hit. And so she was highly successful in cross-training because we knew that in some areas there wasn't the volume, and in other areas we were needing to have team members working there. And so when I think about this team at Hill Country Memorial, I saw the rolling of sleeves up as usual and wanting to learn to do different things so that they could help. And that, I think, is some refreezing of that learning that we need to keep doing. And that was really, really humbling. I would say the other big thing, so that was inside the organization. When I look outside the organization, the group that Penny, you actually chair, and the community stakeholder group, we've been recognized as a best practice with that group. And so for those of you that have not participated in that, it's with city leaders, community leaders, and we meet every couple days at some points during the crisis, or once a week, depending on where we were with the crisis, so that we could get the message out to the community, why it was important to wear masks, why it was important to social distance, what the team inside the hospital was experiencing, what they were experiencing, home care, hospice, in the different areas of the organization. And so what we've learned is that creating that, and we've always been very community focused, but what we've learned is that community stakeholder group was critical to our success. Our mayor put in a mask mandate, And I know that was something that the city struggled with. I give credit to that city leader group and really getting that message put forward, which enables us to have got to a 5% positivity rate. And then Dr. Parton co-chairing a group with the city. I think that's been a learning for us that we need to think about going forward. And there's been, Dr. Frias talked about, we have to we rely on each other. You know, when I think about COVID, and I can think lots of negative, can also see lots of positive that we need to bring with us going forward. So thank you.
And Penny, what I would add is Dr. Frias and Jane have both talked about this, and that is communication. We know that when things are kind of uncertain, more communication can really help calm people down. And so what we changed in our processes and our policies over this time is we really beefed up communication, not just communication with our internal team, with daily, sometimes daily, weekly, or multiple times a week, and that flexed kind of depending on where we were, communication to our team. It also focused on communication to our community. And so doing a lot of work with the stakeholder group that Jane talked about, and then from that cascaded public service announcements that Dr. Parton and Dr. Frias helped us with, website updates that happen very regularly, social media posts, working with school and city and county and the newspaper to determine what those key messages were, and then getting those disseminated to all the appropriate stakeholder groups so that our community felt supported, they had knowledge, they had understanding, and then they knew what they could do to help protect themselves and their families.
Sorry, I've been trying to block out traffic noise in the background and forgot to unmute, but it's really exciting to hear, because those partnerships, I think, are the reason Fredericksburg works in a whole lot of ways. And so using those relationships to help on this front, and I agree with you, Jane, you know, Mayor Neffendorf, I think, showed tremendous leadership in getting it done well before our governor got it done. So I'm really proud of that response. And I think that those really candid conversations is a lot of what leads to those decisions that are hard to make. So what a little question just came in the chat box that I think I'll give to the two doctors in our group. If you've had COVID-19, are you immune? And is that immunity now permanent?
You know, that's something actually that we've discussed many times in our DSHS Tuesday calls. I think early on we said no, because we had all these people having continued positive 3 months later PCR test. Well, now we know those PCR tests are going to stay positive whether you have it or not. So I think that the last information I have is we have no clear evidence that anyone has, again, contracted COVID-19 after already having had the disease. So right now, as it stands, we think that it is going to give immunity. The time frame of how long is still not known, because we don't have that much time frame to have studied this virus. But right now it appears that you are immune. Like I said, we don't know how long. I think part of that immunity is not going to be measurable because the antibodies may wane, but the cell response to the next exposure to COVID-19 may protect you as it then responds to profusely the antibodies at that time. So right now, there's no clear evidence that anyone has caught it the second time. But that's just something that's really kind of being watched and has to be continue to be watched. And it's not something we can say for sure, but we think we're actually permanently, at this point, the virus mutates, immune to that virus.
Yeah, the information with this virus is still very fluid. It kind of comes and goes. So I always tell patients, I think that we have the right information right now, but that might change because we're still in the learning curve. And to really understand the disease process, even some of the diseases that we already know, we need a lot of time to get all that good data and the objective data in. So basically, that just as Dr. Parton said, this is what we know now. If it changes, of course, as I said, ask your providers, get good, reliable sources, so that way you can have on-point information. think there's a lot of firing of information for a lot of sources, and knowing where you get your information and knowing that still this is a very fluid process is important.
And I would also counsel anyone who's had it to not let their guard down, to continue wearing masks, continue social distancing, washing your hands, until we have a lot more information than we have right now.
That's good to know. And no virus ever goes away, right? So it's here with us, and we have to make those safe decisions for each of us. Amanda, earlier you kind of touched a little bit on the subject of telehealth, and we all know, I mean, just because we're all sitting on a Zoom call today, we know the role that technology has played in this. So digital access is key to HCM's strategy map. How did COVID-19 launch the implementation of new technology or education to reach a larger audience?
That's a great question. You know, it's funny, when we looked at our strategy map in the first quarter of 2020, we thought if there's one piece of that we're a little nervous that we're not going to execute on, it would have been the digital access component. But boy, COVID really gave us jet fuel on that and forced us to bring things to reality a lot sooner than maybe we would have expected. And so we knew that patients still needed to be seen. And so we were able to stand up our televisits and have patients seen that way for the immediate care clinic, through the medical group, and get the care that they needed in a safe environment, and still allow our physicians to have that interface with our patients. The other thing that it allowed us to do is not cancel our events altogether. We wanted to make sure we continue to keep our business going for things like joint replacements. Those things didn't go away. And so to be able to offer virtual classes for our joint replacement program, Restore, we were able to do that through virtual platforms. So just like we're meeting here right now on a virtual platform, we've really honed in our skills on digital access for patients and providing virtual platforms for us to interface with our communities.
The other thing I would add to that, Penny, is Dr. Frias referred to access physicians, so our tele-ICU intensivists. Having that resource available to Dr. Frias and to the other physicians was critical. And those ICU physicians are, they're at big hospitals as well. And so we had that availability of intensivists real time, and that was all tele. And so really that, ensuring that they could collaborate with Dr. Frias, the other hospitalists, the other specialists was, I believe, critical for us being able to keep patients here. And then once we got the appropriate medications, be able to keep patients here. And then, as Amanda said, we had televisits in our medical group. And lots of patients don't want to go back to real time coming into the organization. And so it's really testing us on what is our vision for televisits. And then Dr. Parton and Amanda, I think, found this bot that we have put on our website, where you can go onto the website for the medical group, for the website in general, and type in your question, and it's IBM Watson. And Watson, you know him from Jeopardy. He knows all the answers, and so he's able to answer, I'm going to say she's maybe able to answer all of those questions based on our area, because the bot has figured it out. And so when I think about using that technology, we reacted quickly, and in fact, maybe ahead of the game in some. Any of you who've been in the organization know we have thermal scanners that check your temperature as you come in the door. Instead of having to have a staff member checking temperatures like lots of organizations do, we were asked to test it by THA, so we were in the test group, and we do that on an honor system, and we have some really great data around people's temperatures and ensuring that we have resources where they need to be. So we've been tested and reacted, and we're in the forefront.
We have other lines of services. We have infectious disease, which is another telehealth, and we've had it for a while. So we just, got on board. We have our psychiatrists also. We have telepsychiatrists, and other lines of services have jumped on board. and got us the help that we need. So it's been kind of a robust, we have to do this, and as I said, it put jet fuel on us, and we've just been doing it. We knew that we could, and we are.
Yeah, this is one of the ways that rural hospitals can actually offer care that the big city hospitals can through the telemedicine interface.
Mm-hmm.
Well,
And the doctors are very personable. So some of the patients at the beginning of the implementation before COVID, it's like, oh, the doctor in a box, so they would say the robot or that thing. And then when they met the doctors, it was a different story, because it's not the same, but you can do wonderful things and connect to patients through interfaces and technology.
Yeah, unrelated to COVID, we had a patient who was severely ill that before access physicians would have clearly been sent out of the hospital. He remained here, had a surgical procedure that helped save his life, and was on a ventilator for a number of days. And the family was extremely appreciative of the fact that we could care for him here and not have to be transferred to a hospital that have to drive to visit him every day. And so this is pre-COVID. And so like Claudia said, we've been doing this for a while. This is not brand new for us inside the hospital.
Well, I guess I'd like to wrap up with an additional word of thanks to each of you panelists for being here today. And I'll have one closing question for you, but also to our attendees who've made the time to listen to what's happening in our healthcare system in response to COVID-19. So maybe the best way to end our conversation today is to say, as trustees, are there messages that we need to continue to be spreading in the community to help you guys out?
Well, I think the clinical message is, and Claudia will probably echo this, to help us out, wear your mask, social distance, wash your hands, stay home if you're ill, and visit people that you know are ill. That will help us.
Got it.
Yeah, wear your mask is simple. There's really very minimal, if any, contraindications to it. This is not a political issue. It's an issue of us. It's an issue of you. We're just asking you, begging you, please do this simple act that can impact so much. And I think be mindful of your symptoms, seek medical care if you feel you're ill. I think that the most important thing is we're here for you. You have great primary cares, you have urgent cares. I don't think there's ever an excuse at this moment for not seeking medical attention, having the hospital that we have and the services that we give. Try to get your information from reliable sources. As Dr. Parton says, wash your hands, wash your hands, wash your hands. And just make good choices and be good to each other. I mean, that's very basic, but it goes a long way.
Well, as trustees, we need to model the behaviors that we want to see and that we know are effective in making sure that you guys aren't overwhelmed and that you can continue to care for the health of our community. So again, thanks to each of you for sharing your insights with us today. Thanks for those who are attending. And that draws our time here to a close. Everyone have a wonderful day.
Thank you
all. Appreciate you.
Get your flu vaccine.
Yeah, get your flu shot. Thank you.
Bye. Thank you.
Bye.
Bye.